Hello, everybody. This is question 40 of our 100 clinically oriented anatomy questions. Let's get straight into the video. Question says a 43-year-old female is examined by a neurologist to whom she complains of pain in her lower limb of 6 months duration. She has pain in the gluteal area, thigh, and leg. The neurologist observes reduced sensation over the dorsum and lateral side of the involved foot and some weakness in foot dorsiflexion and eversion. The diagnosis of a piriformis entrapment syndrome is made with compression of the fibular division of the sciatic nerve. So this patient apparently has the piriformis syndrome, but the piriformis syndrome specifically affected the common peroneal nerve. The sciatic nerve bifurcates into the common peroneal and the tibial nerve. So the piriformis entrapment syndrome here specifically affected the common peroneal nerve, that is the fibular division of the sciatic nerve. So, which of the following conditions did the neurologist also most likely find during a physical examination of the patient? So, basically, it's the question is asking us that which, aside from the symptoms that the patient has, which other type of condition, which other type of symptom can the patient show, or which other type of condition can the patient show, or can the neurologist find as a result of entrapment of the common peroneal nerve? So paralysis of plantar flexion. Paralysis of plantar flexion is definitely not going to be correct here, because plantar flexion is controlled by the posterior compartment of the leg, and the muscles there are innervated by the tibial nerve. And they didn't mention anything like a weakness in plantar flexion. They only told us there were weaknesses in dorsiflexion and eversion. They didn't mention anything like plantar flexion. It means plantar flexion is very, very okay, which is which basically means that the tibial nerve was not affected. So it means option A is wrong. Option B, instability of the knee due to paralysis of the quadriceps femoris. So paralysis of the quadriceps femoris has to do with the pathology of the femoral nerve, and that is definitely not what the question is saying. The sciatic nerve, the piriformis syndrome does not have anything to do with the with the femoral nerve. Basically, femoral nerve innervates the quadriceps femoris, so it's the injury to the femoral nerve that will, of course, lead to paralysis of quadriceps femoris, which will definitely result into instability of the knee. That is inability to extend at the knee joint. So that is what will happen in B. That is not the case. Option C, foot drop. So foot drop is actually likely to occur here, and it is definitely the correct answer. Why is that? Foot drop is basically inability to dorsiflex. They said there is weakness in dorsiflexion. So inability to dorsiflex due to paralysis of the muscles of the anterior compartment of the leg, and these muscles are innervated by the deep peroneal nerve, which is a branch of the common peroneal nerve, right? So that is definitely the correct answer, because piriformis entrapment syndrome that actually affects the common peroneal nerve is that it's going to affect both branches of the common peroneal nerve, which are the deep peroneal, which supplies the anterior compartment of the leg, and the superficial peroneal, which supplies the lateral compartment of the leg. And this compartment is the compartment responsible for eversion. So that is why there is loss or weakness in foot dorsiflexion and foot eversion due to injury to these nerves. So the correct answer is foot drop. That is option C. So option D says spasm or clonic contractures of the adductor musculature of the thigh. So the adductor muscles of the thigh, these if there is spasms or contractures of the adductor muscles of the thigh, it can be traced down to a problem with the obturator nerve. The obturator nerve supplies the anterior thigh muscles, the adductor muscles, adductor longus, adductor brevis, and the adductor part of the adductor magnus, of course. So um, obturator nerve supplies them, so that is definitely going to be the issue there. And that's not the case here. Piriformis entrapment syndrome does not affect the obturator nerve, so that is not the correct answer. Option E, loss of sensation in the gluteal area by paralysis of the anterior cluneal nerve. So the anterior cluneal nerve actually gives sensation to the anterior gluteal region, and the anterior cluneal nerve is a branch of the iliohypogastric nerve. So the anterior cluneal gives sensation to the gluteal area, the anterior portion of the gluteal area, and it's a branch of the iliohypogastric nerve. So the iliohypogastric nerve is not affected in a piriformis entrapment syndrome. That is definitely not the correct answer. So the correct answer is option C. I believe you enjoyed the video, and I believe you gained from this video. Please like, comment, subscribe, and I'll see you in the next episode. Thank you.